Hello, my name is Penny Drake, and this is my presentation for Management 5810, Information Technology for Business. My presentation is about robotic surgery. This is a picture of surgeons performing laparoscopic minimally invasive surgery. A single surgeon cannot perform this type of surgery without an assistant driving the endoscope or camera, which displays the 2D image on an accessory cart. This accessory cart is often only feet away from the surgeon at the foot of the bed. Also, if you notice, the surgeons only have control of two of the instruments with a very limited range of motion. This is a picture of a robotic surgical device. This is a computer-assisted surgical system. These systems are not capable of performing surgery independently, but are rather manipulated by a surgeon. This surgical system consists of a console, pictured on the far left, where the surgeon sits. Here, the surgeon closely views the 3D feedback that it receives from the endoscope or the camera and uses hand controls to maneuver the robotic arms on the bedside cart to perform the surgery. Next, in the middle is the bedside cart. This cart is docked at the OR table, and the arms which hold the surgical instruments are guided by the surgeon at the console. And then to the far right of the picture is the additional cart, which houses the electrosurgical unit, the endoscope or camera light, and the suction and irrigation pumps. This cart can be placed anywhere near the OR table, but does not need to be in direct view of the surgeon. The U.S. FDA has approved the use of robotically assisted surgical devices to perform minimally invasive surgery by specially trained surgeons in operating rooms. Specialties utilizing robotically assisted surgical devices include general surgery, cardiothoracic surgery, colorectal surgery, gynecologic oncology, head and neck surgeons, and urologic surgery. Common robotically assisted surgical procedures in adults include coronary artery bypass, mitral valve repair, cancer tumor resection, gallbladder removal, hip replacement, pyloroplasty, hysterectomy, kidney transplant removal, pyeloplasty, radical prostatectomy, radical cystectomy, tubal ligation, and many more. The benefits of robotic surgery include shorter hospital stays, less postoperative pain requiring less medication, and smaller incisions than open procedures. There are myths about robotic surgery, especially in pediatrics. Myth number 1, robotic surgery is not safe. Rates of adverse events in open and robotically assisted events are not statistically significant. Myth number 2, there is not a chance of complication. All surgical procedures have a risk of complication. Myth number 3, robotic surgery prevents patients from requiring larger incisions. Large incisions may still be required to remove specimens such as the stomach, kidney, or a tumor. Robotic surgery use in pediatrics includes fundoplication, which is a stomach wrap, for gastric reflux, cholecystectomy for gallstones, oophorectomy, pyloroplasty, removal of the spleen, diaphragmatic hernia repair, biopsy, sleeve gastrectomy and bariatric surgery, pyloroplasty, reimplantation of the ureters, urachal cyst excision for an infected belly button, bladder diverticulectomy, nephrectomy, orchiopexy, and then removal of varices of the scrotum. Recommendations for practice at Inova Children's Hospital include adaptation of the use of the hospital's currently owned Da Vinci robot. This will be accomplished through building an infrastructure to support its use. A budget will be made to enable funding of the instruments and % of the maintenance fee that will be required. Surgeons and surgical teams would then be trained on use of the robot. This implementation will hopefully increase recruitment of robotically trained surgeons and also increase the competitiveness of the hospital by attracting patients who wish to undergo robotic surgically assisted laparoscopic procedures instead of an open procedure. Thank you.